Hi, good morning, you guys. So this morning is my Hsg test. So I went looking into my pantry and I have these ibuprofen 600 milligrams from my laparoscopic surgery that were left over. So I think I'm gonna take one of these 30 minutes before my appointment. I'm still about an hour early, so I'm gonna wait off on them. I'm just gonna take them with me, and then I'll take a bottle of water as well so that I hopefully feel no pain, because I am such a weenie when it comes to any doctor's appointments or like any procedures. Also, I wanted to explain my video from yesterday. I don't think I really explained why I was so upset. So basically, when I went in, they should have had an order for a urine test, but instead they had lab work done, which is the same lab work that I did at my fertility clinic. So I think I was mainly most upset because they withdrew blood from me that was unnecessary, because I literally just got these tests done, like 3 weeks ago, and I just felt kind of violated. I felt like they're sucking the blood out of me for no reason. So I took it really personal. I'm over it now, but I don't think I really explained to you guys why I was upset. So I wanted to clear that up. So anyways, let's move on from that. Okay guys, I'm here. I'm definitely feeling nervous now that I'm here. My heart is beating so fast. I swear I'm such a wuss when it comes to these things. So I was sitting here reading my ibuprofen, and it says that I have to take it with food. So I dug in my purse, and all I could find was this old Nutri-Grain that was at the bottom of my purse, and it's all flattened out. So I'm gonna take a couple of bites of this before I go in. My appointment is at 9:40. It is currently 9:11. And I'm not quite sure where I'm going, so I'm gonna head out a bit early so that I can find the right place. Okay, so I'm only gonna take one. So I don't know. I think what I'm gonna do is try and film the screen, kind of like when I went in to get my transvaginal. This is Kaiser, so I get a feeling they are maybe a bit more private, but I'm gonna try and film it on my phone so that they're not too suspicious. And I will try and maybe just point the camera at me, and if at any point she's not looking, I'll try and get the screen. I don't even want to try and ask, because I don't want her to say no. I really want to get it on screen, not just for you guys, but for me. I like to come back home and like really look and analyze at, you know, my uterus and my fallopian tubes and all of that. So that's the plan. All right, so I'll see you guys in there, and if not, I'll see you guys when I get out.
And there's going to be a little pressure here. Sorry about this. Then I'm going to have to move this around to find your cervix, trying not to pinch you.
Okay.
Here. Your cervix is very tiny. Pinpoint. That's not either good or bad.
Okay.
Okay. You're going to feel some pressure here now. Dear.
Okay.
Sorry. Now that, advance the catheter. Now this is the balloon. Sorry about this.
Oh.
And I can, yeah. Now, seems like it wants to go only partial. I'm going to stop it there. So I'm sorry, this is the worst part, but it has to be retained that way. I will check that on X-ray in a moment. Okay. Now I'm going to set up for the X-ray. What happened? You're going to feel pressure here. Sorry about this. No, your hand.
Oh,
Here,
sorry.
I'm sorry, up on your chest. Okay, I didn't notice that. Okay, let's do the oblique, Lisa.
Which way do you want her to turn?
Oh,
Is that it?
so it's going to go, yeah, you did great.
Oh, okay.
You're going to drain some fluid, a little bit of blood. Not bad. They give you antibiotic?
No.
Okay, usually they do.
Can I have some?
No,
No?
it's something that, I'm just asking. Yeah, I don't prescribe it, your doc does, but a lot of them don't. Are you okay?
But
Yeah.
I mean, I'm prone to getting infections,
Well,
and
you should
this
talk to
has
him.
happened before where I don't get antibiotics and then I get an infection.
Your doc should have, you've got to phone him.
Okay, you guys, so I did it. It's done. I'm gonna say from a scale of 1 to 10 pain level, it was probably a 7. And it was only like that. I only felt the pain when he inserted the long needle. If you guys don't know what the process of an HSG is, let me just tell you guys that really quick. So basically, it's like a really big, like plastic tube needle that you probably saw in the video. It's the blue one, and at the end of it there's a balloon. So they basically insert that into your cervix, which he said my cervix was teeny tiny, my opening, and then they inflate the balloon inside of you, and then from that opening they inject the ink into your uterus, and then they have that x-ray machine over your stomach where they take images to see if the ink is leaking out of your fallopian tubes. So the good news is my fallopian tubes are open, both of them. So they both leaked ink. So I'm really, really happy about that. I think right now I'm just still a little flustered over the whole thing because it was painful and I had to go pee really bad. I felt like I was gonna pee on him in the process, but I'm just glad it's over. So he did mention that in most cases OBs give their patients antibiotics to take before the procedure and after the procedure, and I didn't get any of that. Here's another reason as to why I get really upset with Kaiser, because they don't take preventative measures like this. And in 2 different instances with other situations, they've never given me antibiotics, and I end up getting these massive infections that put me out of work for a whole month. I'm just really, really prone to infections. So I am gonna do the same thing I did yesterday, walk into my OBGYN's office, ask for antibiotics before I leave. I just really hate that I even have to go out of my way to do these things when it's their job to do it. As long as I get my antibiotics before I leave today, then yeah, I can start celebrating that my tubes are open and start moving towards our next step. So yeah, I'm really excited. I had to buy a muffin in there because I have to take my antibiotics with food. But you guys, coming to the doctor or a hospital, especially when you're dealing with infertility, it should not be this stressful. And I swear, every time I come to Kaiser, I end up leaving really upset, and it like ruins my day because they just don't have their stuff together. For example, I went up there requesting to talk to someone about getting antibiotics. I spoke with 3 different assistants in the OBGYN department who had no idea what an Hsg test was. So I had to explain to them, and I had to explain why I need antibiotics and why I'm not leaving without it. So I just feel like such an asshole every time I come here because I feel like I have to get very mean in order to get what I want. You know what I mean? So I threw a fit. I demanded to speak with a doctor, and the doctor didn't even question me. He was just like, here's your antibiotics. Probably because I was in there yesterday throwing a different fit. You know what I mean? But it shouldn't have to be like this. And it makes me feel like a bad person that I even have to throw fits. So anyways, I got the antibiotics. So I just have to take one in the morning, one at night for just 2 days. I will probably talk to my husband about what our next step is. And then once I have communicated with him everything and discussed everything and discussed it with my fertility specialist, I will come back to you guys and let you guys know what my plan is and what the next step for me is. Thank you so much for watching. Please subscribe. If you want to be a part of my journey, give me a like, and if you have any questions about the procedure or anything, go ahead and leave that in the comments below. I always go back and respond to everyone. Have a good day. People sitting in front of where I'm at, and they're probably wondering who the hell I'm talking to. And they're just sitting in their cars in front of me. It's so awkward. Like, can I finish my conversation with my friends? Gosh. Okay, you guys. You know what I'm gonna do next? I am parked right outside of Hobby Lobby because I'm gonna finish my fall decor decoration. So, thank you guys so much, and I'll see you on my next video. Bye.